Right. Hello, my name is Jamila Diaz. We're going to be talking about our formal paper, ABP group proposal.
Okay. Hi, my name is Kim Cisneros, and our purpose statement is going to say the purpose of this project is to investigate the effectiveness of timely change of IV sites instead of routine to prevent infection. Our topic is going to be preventing infection in the hospital, and we chose this rationale because of the outdated practice of routine IV site changes in the hospital. We're taught to change them every 72 to 96 hours. But current evidence shows that changing the IV site when only clinically necessary is just as safe and does not increase the risk of infection. But although that may be the rule, although the research shows that many healthcare settings still continue to change the IV sites every 96 hours, leading to, patient discomfort and unnecessary interventions.
Okay, rationale for selecting the intervention. This intervention was selected to address the outdated practice of routine IV site changes every 72 to 96 hours, despite current evidence showing that clinically indicated changes are just as safe. Studies showed no increase in infection or phlebitis rates when IVs are changed only as needed. However, many healthcare settings continue routine changes due to lack of awareness or policy gaps. This highlights the need for better knowledge, translation, and adoption of evidence-based infection prevention practices. Our improvement goals. This project aims to reduce unnecessary IV site changes, improve patient comfort, and support nursing efficiency without increasing complications. Specific goals include decreasing routine IV site changes performed before clinical need, maintaining or improving current infection and phlebitis rates, and promoting adherence to evidence-based guidelines and enhancing patient experience by reducing comfort from unnecessary IV insertions.
Hi, my name is Shana Gabriel, and why is this topic important and why did our group choose this subject? So infection prevention, changing IV sites only when clinically necessary, does not increase the risk of infection and phlebitis. Leaving it in for more than 96 hours does not increase patient risk of infection. So for this topic, we chose it because infection prevention and changing IV sites only when it is clinically necessary. The reason this topic is important is because by finding out if it's really necessary to change the IV site every 96 hours, we can determine whether this common practice actually reduces infection risk or if clinically indicated changes are just as safe. Also, we can potentially improve patient comfort, reduce unnecessary procedures, and optimize resource use in healthcare settings. Our group chose this topic because we believe it's important to understand the reasoning behind changing IV sites every 96 hours and to explore ways to improve patient care.
Hello, my name is Helen Del Rio, and these are the references that we used. We used a total of 3 articles. One of them is optimal timing for peripheral IV replacement. The other one is guidelines for the prevention of intravascular catheter-related infections. And then lastly, clinically indicated replacement versus routine replacement of peripheral venous catheters. Thank you.
Okay, and now we're gonna move on to the questions.
Okay, so expectations that we've set for the group is that we're all going to contribute the same amount of work to do the research and writing, communicate on time, and clear communication via group chat and email. We have a group chat that has been working successfully. If there's any other meetings, we'll be sure to attend them on time and respect everyone's opinions and be open to feedback.
And our group rules are that each individual agrees to the following contribution to the team projects and activities. that we stay engaged and complete assignment tasks on time, we meet deadlines for all group deliverables, be respectful and collaborate during discussions, and communicate conflicts or challenges early to find solutions.
So for our goals, we hope to accomplish to finalize a proposal that explores the clinical outcomes of clinically indicated IV size changes versus the 96-hour change. We want to gather strong support evidence to justify a shift in practice, raise awareness about reducing unnecessary IV insertion and improving patient care, as well as strengthen presentation and collaboration skills in preparation for future clinical work.
The topic for the proposal is clinically indicated IV catheter sites changes versus routine 96-hour changes. It's important because IV infection and phlebitis contribute to morbidity and patient discomfort. Research also shows that there's no increase in infection risk when IV sites are changed only as needed, and it promotes evidence-based practice, improves resource use, and enhances the patient care.
Okay, and that was all. Thank you.